Welcome back to Generation Sick, the power, politics, and propaganda behind America's health crisis. Written by Dr. Vic Naumov. Copyright 2016. All rights reserved. Last episode, we covered the biggest stretch of the book yet, ending on Dr. Naumov's core message that your health is fundamentally your own responsibility. Today, we're covering chapters 14 and 15, the chapter that actually shares its title with the book itself, Generation Sick, and a shorter, more personal chapter about choices, conditioning, and the roots of addiction. Let's get into it. Dr. Naumov opens this chapter with two quotes that set a heavy tone. The first comes from federal prosecutors describing the case of Dr. Farid Fata, an oncologist convicted of performing unnecessary cancer treatments on patients who didn't need them. Prosecutors put it bluntly, patients were not people, they were profit centers, end quote. Federal prosecutors on the Farid Fata case. The second is from a front-page New York Times piece by journalist Gina Colata, published in November of 2015, describing something genuinely alarming happening to middle-aged white Americans, rising death rates, driven not by the usual killers like heart disease, but by suicide and substance abuse, including alcoholic liver disease and overdoses involving heroin and prescription opioids. From there, Dr. Naumov takes us back to the work of Ivan Pavlov. Yes, the same Pavlov, famous for his salivating dogs. Dr. Naumov walks through how Pavlov's real scientific contribution was studying ongoing, chronic, physiological processes in living animals, rather than the older method of simply opening an animal up after a single dose of some chemical. Pavlov's discovery that he could trigger a physical response, salivation, purely through conditioning by ringing a bell before feeding time, became one of the foundational concepts of 20th century psychology. Dr. Naumov's argument is that this same principle of conditioning didn't stay confined to a laboratory in St. Petersburg. He argues that an entire century of pharmaceutical marketing has been built, consciously or not, on exactly this kind of conditioned response, training people through repetition and association to reach for a drug the moment they feel any kind of discomfort. And the scale of where that's led us is sobering. Drug overdoses are now one of the leading causes of death in the United States, and the numbers have grown dramatically worse just in the years since this book was first written. According to the Centers for Disease Control, drug overdose deaths in recent years have actually surpassed motor vehicle deaths and firearm deaths combined. This isn't a hypothetical concern Dr. Naumov is raising. It's one of the defining public health crises of our time. Dr. Naumov also takes aim at the sheer volume of direct-to-consumer pharmaceutical advertising most Americans are exposed to daily. Those instantly recognizable jingles and feel-good commercials that train viewers year after year to associate any symptom with a corresponding pill. He points out the almost absurd nature of some of this marketing. Warnings about rare, dramatic side effects are listed precisely because, paradoxically, they make the drug sound more powerful and exciting to a worried consumer, not less appealing. He's careful here to note that not everything in this category is bad. Drugs like ibuprofen and naproxen sodium provided real relief compared to older options like aspirin. But he also points out something the FDA itself eventually had to acknowledge. These same non-aspirin pain relievers carry an elevated risk of heart disease and stroke, creating a strange cycle where the medication meant to relieve minor pain ends up requiring another medication to manage the side effects of the first one. Dr. Naumov spends real time describing the economics behind pharmaceutical clinical trials. Young, healthy volunteers compensated to test new drugs, while the people who ultimately use these medications once they reach the market are often older, sicker, and taking multiple other medications simultaneously, creating interactions and risks that a clean clinical trial population would never reveal. His broader argument is that the testing pipeline often optimizes for getting a drug approved as quickly and cheaply as possible, rather than ensuring it's been thoroughly evaluated specifically in the population that will eventually be prescribed it. He returns again to the idea of psychological conditioning at the level of the doctor-patient relationship itself. The diploma on the wall, the white coat, the stethoscope, arguing these symbols are designed, intentionally or not, to build a level of trust and deference that can make patients reluctant to question a recommended course of treatment, even when their own body is telling them something isn't working. Dr. Naumov draws an important distinction here that's easy to miss. He's not arguing that doctors are typically acting maliciously. He specifically separates out the rare, genuinely rogue doctor who knowingly overprescribes or commits fraud, from the much larger group of well-meaning physicians who are, in his view, simply operating inside a system with built-in financial pressure toward more tests, more visits, and more treatment, regardless of individual intent. The chapter ends on a passage Dr. Naumov clearly put a lot of thought into, a call to treat the entire medical and insurance system as part of what he calls the human comedy, rather than as the ultimate arbiter of your health and your life. His advice, distilled down, is this: combine genuine personal responsibility with healthy skepticism. Eat well, move your body, sleep properly, build strong relationships, and approach the healthcare system as one tool among many, run by fallible people with their own incentives, not as an infallible authority to be obeyed without question. Chapter 15 takes a more personal turn. Dr. Naumov opens with a familiar quote from Edward Bernays, the same propaganda pioneer we met all the way back in Episode 2, a reminder that our ideas and tastes are shaped, often invisibly, by forces we never see. From there, Dr. Naumov shifts into something closer to a personal parenting philosophy. He describes how he and his wife raised their own children to understand a clear, simple principle, that the first time you use any substance, that's a genuine choice. What happens after that first use, he argues, can change quickly as the body begins to physically adapt and crave the substance again, turning what started as a want into something that feels like a need. Now, it's worth pausing here to add some important context the book itself doesn't fully capture. Addiction researchers and the medical community broadly recognize substance use disorder as a genuine, treatable medical condition, shaped by a complex mix of factors including genetics, brain chemistry, mental health, and life circumstances, not simply a single moment of poor judgment. Many people are prescribed the exact same medications after surgery or injury, and their bodies respond very differently to them. Some develop dependence, many don't. Dr. Naumov's broader point, that the first exposure to any substance is worth taking seriously and that prevention matters enormously, is well worth hearing. But it's also worth knowing, especially if you or someone you love is struggling with addiction right now, that this is a real medical condition that responds to treatment and support, not simply a failure of willpower to be overcome through choice alone. Where Dr. Naumov's argument lands most usefully in this chapter is in his critique of how casually pharmaceutical advertising normalizes reaching for medication at the very first sign of discomfort, and in his point about how closely children watch and absorb their parents' own relationship with medicine. If a child consistently sees pain treated as something to be immediately eliminated with a pill rather than something to be understood, monitored, and sometimes simply tolerated for a short while, that's a pattern that can shape how that child relates to discomfort, medication, and coping for the rest of their life. His core suggestion, stripped down to its most useful form, is this: be thoughtful and deliberate about every choice involving any substance, prescription, or recreational. Model that same thoughtfulness for your children, and recognize that prevention and awareness, started early, matter enormously. And if a real struggle with dependency does take hold in yourself or someone you love, that's exactly the moment to reach out for real medical and psychological support, not a moment to retreat into shame or self-blame. That's it for Episode 8 of Generation Sick. If anything in today's episode touched on something personal, your own relationship with medication, or someone you care about, please know that real help and real treatment exist, and reaching out for it is a sign of strength, not failure. In the next episode, we keep moving forward. If you want to be there when it drops, hit subscribe and turn on notifications. And if today's episode gave you something to think about, share it with someone who needs to hear it. That's how we restore the power to the people, one listener at a time. I'm narrating Generation Sick by Dr. Vic Naumov. I'll see you in Episode 9.